Hello everyone. Imagine having a simple fall and having a fracture. Imagine that being repeated again and again. It's a stark reality because most of the patients who suffer these fractures have underlying osteoporosis which goes unnoticed. They come to us, we patch them up and we send them back, but we never get them treated for osteoporosis. Today on World Osteoporosis Day, we need to confront the crisis in bone health, which is silent and declare it's unacceptable to have this. We need to know what is osteoporosis and how do we fix it. Osteoporosis is a disease which makes our bones very fragile and weak, like a honeycomb which has lost its integrity or its density. We need to know that this is not a problem just for ages. It can happen to anyone, but most commonly it happens in people who are above 50 years of age or women who have undergone menopause. There is a major gap in diagnosing and treating the disease. Around 80% of patients who come to us with fragility fractures go undiagnosed for osteoporosis, and they never get diagnosed or treated for osteoporosis. The consequences of these are very severe because this leads to repeated fractures, chronic pain, loss of independence in the patient, and their life becomes really miserable. Worldwide, every 3 out of 5 women who have after menopause and every 1 out of 5 men after age of 50 suffer osteoporosis, but nearly 80% of them undergo undiagnosed. Causes of these are many. Most commonly we can say age, because after menopause there are a lot of changes in women's body which leads to bone weakness. Most of the men who are above 50 years of age, diet which is less in calcium, less in vitamin D, sedentary lifestyle where people are just office goers, desk jobs, who don't get enough exercises, people who have high smoking or excessive alcohol intake. These are people who suffer most for osteoporosis, and these are the most susceptible ones. How do we treat this? We need to ask for help. You need to go to your orthopedician and ask for bone density. You need to get enough of calcium, vitamin D rich nutrient diet. You need to get enough exercises and have a very active lifestyle. Strength training really helps in getting the bone strength back. And most importantly, we need to protect our elderly from bumpy places where there is high chance of fall leading to fractures. If we can prevent the fractures, we can do the treatment much easier way. For too long, osteoporosis has been a silent disease which has been dismissed as a age-related illness. It's not. It is treatable, it is preventable. On the World Osteoporosis Day, we declare it's unacceptable to go undiagnosed. We should get diagnosed and get help for it. Thank you so much.